Good day, ladies and gentlemen, and welcome to Your Addiction, a call with Diana Spencer and Sarah Holt. All lines have been placed in a listen-only mode, and the floor will be open for questions and comments following the presentation. If you should require assistance throughout the conference, please press *0. At this time, it is my pleasure to turn the floor over to your host, Anna Bobb. Ma'am, the floor is yours.
Thank you. Well, welcome. This is Anna Bobb, the Health Programs Director at the Philanthropy Roundtable, and welcome to our guests, filmmaker Sarah Holt and Foundation Head Diana Spencer. Our call format today is pretty simple. We'll have 20 minutes of discussion by our guests, followed by about 10 minutes of Q&A. If at any time during this call you want to be put in the queue so that you can ask a question during the Q&A portion, please just press *1. Diana Spencer will be leading our call today and introducing Sarah, but before I introduce her, I do want to say a quick word about Sarah in the film. We chose to bring Sarah in today because her name just seemed to come up again and again in conversations I had with philanthropists. And I think this is because her film has been successfully used by philanthropists and many others to really start conversations about addiction, especially in local communities. So we'll learn more about that on our call today. We've asked Sarah's longtime collaborator, Diana Spencer, to introduce her today. Diana leads the William G. McGowan Charitable Fund. William McGowan was an entrepreneur and a self-made man. He led MCI from being a small local radio service to a multi-billion-dollar telecommunications giant. The fund's health portfolio includes gifts made in medical research as well as gifts made at the intersection of mental health and homelessness. They focus on 5 regions: Denver, Chicago, Kansas City, upstate New York, and coal miner country in Pennsylvania. So with that, I'm just so pleased today to introduce you to the executive director of this foundation, Diana Spencer.
Thank you, Anna, and good afternoon, everyone. It's so great to be with you today and to be introducing you to Sarah Holt and her compelling film, Addiction. So Sarah and I go back about 10 years when I was looking for a documentary producer and writer and filmmaker to create a story on Bill McGowan and his experience and his leadership during his years at MCI Communication. So I found Sarah came highly recommended from another documentary producer, and she took this project and just ran with it and did a tremendous job. So as life goes on, I didn't hear from Sarah for some time after we successfully produced this film that aired on PBS on many, many stations. We did premieres across the country and just had a wonderful time really sharing an unknown story. So Sarah reached out to me last summer, I think it was June, and she asked about getting help to screen an important piece of work that she had just done. The film was Addiction. I did not know that at this time. It had not aired on PBS. And so we were able to get it screened in the National Archives, and it's since been screened in many other cities across the country very, very successfully. So I'm really pleased to introduce you to Sarah Holt, tremendous documentary film producer, and to her film Addiction.
Thank you, Diana. Really appreciated having the screening at the National Archives. I think 250 people turned out, and we had a terrific panel. So that was one of the highlights for me after the film aired. Thank you.
My pleasure. So, Sarah, you know, your film, when I first watched it, was so painful, so real, telling the story of this epidemic across America. You've so eloquently put together these stories of 3 people struggling with addiction. I'm wondering if we can just go through and have you tell us a little bit about the story. And so if we could start off and you could tell me about the character of Jason. You know, how is his story really the story of America's struggle with opioids?
Well, it's a national epidemic, but I wanted to go to West Virginia because it has the highest overdose rate in the nation. And I was looking for a character like Jason because so many Americans fell into addiction because of injuries. Jason was a miner, hardworking miner. He lost his leg in a mining accident and couldn't support his family on the disability. So he's back at work, hobbling, doesn't have his prosthetic leg, crawling wherever he can go, and taking opioids to get through the day. And before he know it, he's crossed that line into addiction. And I remember the most interesting thing he said to me was the first time he realized he was in trouble. It wasn't because his leg was hurting. It was because he didn't have enough pain pills. And he was going into acute opioid withdrawal. So
So this is a story of so many people and how they're falling into addiction today. I don't know if anyone saw on the front page of the Wall Street Journal today, but it was about a huge bust of people dispersing too many drugs, too many opioids in this very setting, where people become addicted and then they're just, it's spiraling out of control. So I don't know that is the primary way that people are becoming addicted, but you have other stories too. Jason's focuses on injury and becoming addicted on opioids through pain medications, which I know sometimes is translating over into other substances once they're no longer to get those prescriptions. But you also talk about Jonathan. What was it about Jonathan's situation?
One of the reasons that I chose Jonathan was because he was given ADHD medication, and he really had depression and anxiety, but he was misdiagnosed. And he was the son of Admiral and Mary Winnefeld, but grew up in a really hardworking, successful military family. Admiral Winnefeld was on the Joint Chiefs of Staff. I mean, his parents were dedicated to him, but unbeknownst to them, he couldn't sleep at night, so he started to medicate himself with alcohol, and then he began to smoke pot and take Xanax, and the next thing they knew, he was using heroin. So one other way that young people, fall into addiction is through issues of mental health. And, Admiral Winnefeld told me he never understood the battle he was going to have to save his son. He thought he could win any battle, and then he faced this battle with the son. I don't know if you want to go talk about the other characters and come back to how they tried to treat Jonathan.
I think that would be great. So you have one more character, Macy, whose story is a little bit different too. But, the one thing that I'm hearing and that I saw through your film was that there is no prescribed individual or family. This can happen to anyone in the country today. Yeah.
And one thing her name is actually Casey. She was an African-American teenager who unfortunately intersected the medical system at precisely the time when everyone was saying pain, vital sign, we treat pain. She had inexplicable pain. She actually, later they found out, had fibromyalgia and rheumatoid arthritis, but at 14, they ended up operating on her to remove these benign masks. And during her stay in the hospital, about 6 weeks, she was given copious opioids. And when she was sent home, she started having a lot of pain, but not near the site of the opioids. So once again, like Jason, unbeknownst to her family, she was actually going through acute opioid withdrawal. They didn't know what was wrong. They kept rushing her back to the emergency room, and every time she'd be given opioids. So this was before they started keeping, very good track of drugs and who was being prescribed what. But, she was an adolescent, and we know that the brain is still forming, and 21% of all cases of addiction 90% of all cases of addiction start before age 21. Her father had a history of addiction. He had moved his family out of Oakland because he wanted to put his daughters in private schools because he was determined to avoid it. So she had probably a genetic predisposition towards addiction as well. But what made her addicted were the opioids she received from her doctor.
Mm-hmm. You bring up such a good point about the predisposition. To me, it feels like there is so much knowledge about other diseases, heart disease and stroke and cancer. We have so much research that has occurred today, and we have good treatments and preventions in place. I'm wondering, Sarah, if you could just maybe step back a little bit and talk about what is addiction?
I think the thing that Well, I knew when I set out, I was very tired of seeing all these films that focused on overdose deaths. And as I began to talk to doctors, they said to me, this is a treatable brain disorder. So when you repeatedly expose your brain to drugs, it adapts. And, so once you cross this line into addiction, there's really kind of a horrific cycle that starts to happen. Your brain literally changes. The regions that are crucial for making decisions, the chemical balance of neurons, your motivational drive, everything gets blunted. And so I think that the most important thing is that you overwhelm your brain with dopamine. Drugs release massive amounts of dopamine. Dopamine is just critical for getting out of bed in the morning, for finding food and rewards, and we're hardwired to find rewards. But with drugs, they're the highest reward you can possibly get. You get 10 to 20 times more dopamine. So what happens is that your body cuts back its natural supply of dopamine, and you get this horrible cycle of withdrawal. And that's what Casey started to go through, was going through. And you feel lower than low because your body stops making dopamine. And so you wake up and all you can think about is, how can I go use a drug so I'm not sick? And acute opioid was understand as I begin to talk to people are terrified of going through withdrawal. It is incredibly painful. You're sweating, you have nausea, your muscles ache, you have fevers, you're shaking, you have incredible anxiety. All these stress hormones are being released. And people wake up and all they can think about is not being sick. And that perpetuates this cycle where you go back and you use again and then you get intoxicated and then you come down and you withdraw. And so this is the cycle that starts to perpetuate addiction. And that's why people think it's a matter of willpower. But you're really caught up in a biologically driven cycle, and it's very, very hard to break it. It's not impossible. We know people get better from addiction, but that's what makes it so challenging to break.
Mm-hmm. So willpower, when you say that, it's like, oh my goodness, that's really a very painful thing to think about, asking someone to recover through willpower. So what type of treatments did you learn about that are needed? So treatments of overdose and then treatment of the disease itself. So there's when someone is overdosing and the drugs that they're prescribing today. I wonder if you could talk a little bit about that. And then also about some other types of programs before someone has overdosed that you learned about.
Well, the film actually, although all drugs of abuse impact the brain by overwhelming it with dopamine. We ended up looking mainly at opioid addiction because it's actually one of the easiest addictions to treat today, and that's because we have these incredible new medications that stop acute withdrawal and they stop the cravings that make people prone to relapse. And methadone is one that's been around for a long time, but there's a newer drug called Suboxone. And you can take that in the privacy of your own home. And it's really transformed the treatment of opioid addiction. And both of these drugs cut the risk of overdose death by half. They have a far greater chance of keeping people engaged in treatment. You can't overdose on another opiate because they block the receptors, so they keep you alive. So that was kind of an eye-opener because I finally met addiction doctors that were happy to go to work. They felt like they saw their patients getting better. And the tragedy with Jonathan Winnefeld, it's a tragedy that's being played out again and again across this country. His parents put him in an expensive treatment center. They spent $300,000 for 15 months of inpatient treatment that was really abstinence in the 12 steps. And they believed when he got out, he was going to be better. And he went back to college, and within 1 month, he was dead of a heroin fentanyl overdose. And the sad reality is that for opioid addiction, that type of treatment has an 80 to 90% failure rate. And, Admiral Winnefeld saw this film and looked at me and said, if my son had been on Suboxone, he'd be alive today. He did tell me, if I'd seen your film, I think my son might be alive. And the tragedy is that Jonathan should be alive.
Well, and it is indeed a tragedy. I know that it seems to me that today everyone knows someone who has gone through this horrific experience. So it's definitely an epidemic. There were doctors in your film who really talked a lot about the treatment and how lives could be saved. Did you learn through the film whether or not the drugs are being prescribed more? Who are they going out to? So are they only in emergency rooms today? Are they equipped with paramedics? How are communities addressing this today? And I'm wondering if you could also provide some thoughts on, your film has been wonderful, but how can we get communities also talking more about this epidemic?
Well, I mean, one thing that so I think that medication-assisted treatment is slowly being accepted. When I first started making the film, I didn't feel that way at all. I felt like it was very, very hard to get. But I think that that's slowly beginning to change. And one of the things that could really make a difference is if you could provide it in an emergency room after an overdose. Because what happens is we now have a drug called Narcan, which can stop people from dying. It can reverse an overdose. But what it does is it puts people in acute opioid withdrawal. And so many people are being revived from overdoses and just being released on the street. That was the other thing that shocked me, is addiction is not part of the medical system. We don't treat it like other diseases. If you have a heart attack and you come into an ER room, there's a whole protocol. And they have a place for you to go depending upon your need. If you come in most emergency rooms in the country, and you've suffered an overdose, there's really no place to put you. And people are just released back out on the street, and worst of all, they're in acute opioid withdrawal and are likely to use again, overdose, and die. So there is a push to start making Suboxone available in emergency rooms. But I think there are only a handful of emergency rooms across the country that provide it. So that's, I think that communities across the country have rallied to get Narcan. What I'd love to see is for them to rally also and make a medicated-assisted treatment, available.
Yes, to establish some protocols, first of all. So, you mentioned that emergency rooms don't treat addiction like other diseases with a full cadre of supports that are provided upon arrival. It's not only that, but people who come in with an overdose are maybe not treated like it's a real disease, but more of a social disease. And in the past, I think addiction, we started off, and as a child, I knew about a great uncle I had in my family who had alcoholism. And everyone talked about, Uncle Forrest and so forth, and he would spend time in various families' homes, and it wasn't ever discussed like it was a disease. So I think that there is still such a lack of knowledge. It's almost like we are in an infancy of disease discovery in this area of addiction. So definitely protocols within emergency rooms would be so helpful. Any other ideas about gathering? So I know you've done a lot of screenings across the country with this film, but how have communities used this to come together to at least start the conversations on addiction and what can be done to first of all learn how much is going on in their community, because it seems to be rampant across the country? And do you know of things that have happened, as a result of people coming together around your film?
One of the things I know is that a few people that were running sober living houses that refused to take people on medicated-assisted treatment. One person who saw the film called me back up and said, we will now take people on medicated-assisted treatment, because they were very much in this kind of abstinence-only mode. And there were a lot of people that were getting onto drugs like Suboxone who had no place to live. So that was really heartened to hear that. NOVA was able to get some grants in, which allowed us to make free DVDs. So anybody who reaches out to us and wants to have a screening in their community, we can actually give them free DVDs. And they also were able to raise money to do educational outreach guides and material, and some of that money I think also enabled us to do some of the big screenings we've done. We screened the film several times in West Virginia and New Hampshire and Arizona and Washington and many, many times in Boston. I mean, I'm it's getting to the point now where I was trying to get to all of those screenings, but I can't always get to them because I have to keep working on my other films. But
sure.
It's been great to see. Almost every day I open up my email and someone's written me, and I'm so grateful that I can say to them, you can actually get a DVD of this film and have a screening with your friends or your support group. And then the other thing was that we were able to keep the film from going behind the wall. So until 2027, people can go and screen the film.
That's wonderful. And did you tell me that you also had spoken or someone spoke as a result of the film at a local high school?
I'd gone to high schools and shown the film. So that's really meaningful, and I think the kids. I wanted to make a film that focused on hope because the people in my film recover, and I really, people do recover from addiction, especially when they get the right treatment. And it's not just medications. There's a whole range of cognitive behavioral therapy, motivational interviewing, mindfulness training, and support groups. I'm not against support groups. I just think that they're not necessarily the primary mode of treatment. So I just lost my train of thought. But the message that I wanted to get out was people can recover especially when they get the right treatment. And one of the things that's so hard for me is to see this moralistic view of addiction, and it's reflected in these statements like "let someone hit bottom." And I'll go out and tell parents in this epidemic that kind of tough love can kill. I think it's really important. There are some incredible groups that are doing work trying to help families learn that they can stay engaged and committed without enabling their loved ones. I hope that very harsh, tough love, let them hit bottom approach will start to wane, because addiction is a disease and people need support.
Well, first of all, I would say that your film is about hope, and I'm so grateful that you made this. You always introduce such wonderful and compelling topics that need to have attention focused on them. So my hope is that people continue to watch the film and continue to open up more dialogues in communities around the problems of addiction and all of the things that can be done. I really love that we're coming into a time where cognitive behavior, the science of behavioral change, is more up and coming than I've ever seen it during my time in philanthropy. And so it gives me hope. It gives me hope that people are going to be able to recover, that they're not going to wind up in the justice system or, the worst case scenario, die, and that we can really get a handle on this as a disease in our country that's so important to solve, just like any other. So thank you for this.
You're welcome.
Well, Sarah and Diana, this is Anna. Thank you both so much for this absolutely fascinating conversation and discussion. We're going to move on now to the Q&A portion of our call. So, as mentioned, if you have a question, please press *1, and I think we're going to ask our moderator to help us with this process.
Thank you, Anna. The floor is now open for questions. As she said, it is *1 on your telephone keypad if you have a question or a comment. And if you're using a speakerphone, please pick up your handset to provide the best sound quality. And we can pause just a moment to give everyone a chance to signal. And Anna, it appears there are no questions at this time, so I will turn it back over to you.
Oh, well, wonderful. Well, let's see. I think I would like to maybe ask one question. Sarah, you know, if you could have everyone on this call watch just one scene in your film, which scene would it be?
That's really hard. Well, as moving as I think the human stories are, I think I would have them watch the scene which just explains what happens when someone crosses that line into addiction. You know, we have a science sequence where I went to Stanford and Dr. Robert Malinka showed us how reward shapes behavior. And in his lab, we literally watched a mouse, start to express incredibly addictive behavior as it kept getting a jolt of dopamine by pressing a lever. And then we have the whole animation that explains the brain changes that occur when you cross that line. And I just think it's so important for people to understand why this is a brain disorder, and in fact that we have medications then that can help normalize the brain functions that get damaged in addiction.
Yeah, that's interesting. That is one of the scenes that I really loved as well. And we actually have that scene. We placed that scene as just a clip, and we're going to put it on our website and make sure we send a follow-up after the call so everyone can look at that and look at the science of addiction, as well as get some information about and really have some clips about some of the stories that you mentioned that you described on your call. So those videos will be available. Nova was good to make those available to us. The time has flown really fast. We're kind of at the end of our call. So if we don't have any questions, I think we are going to draw this to a close. As Sarah's, yes, Molly, yep.
We do have one question from Elaine Fawcett with Hammer and Associates.
Okay,
please
great.
Go ahead.
Hi, can you hear me?
Yes.
Yes. Okay, great. Hi, everyone. This is Elaine. I work with Hammer and Associates, and we are in the process of working with a new private foundation based in Denver that is just in its early formation, but looking to find solutions to end the opioid crisis and support those in recovery on a national basis. So thank you so much for your film. I can't wait to watch it. I had one question about the medically assisted treatment. In some of the research I did or read recently, what I heard was that there can be a lot of barriers for physicians who might consider using that type of treatment. I think one of the anecdotes I heard was that if physicians decide to offer that type of treatment, then their prescriptions get audited, and it can be a lot of red tape for them. And I'm just wondering, in your research and work, did you hear of those similar barriers? And if you did, then what would be some possible ways to work around that or overcome those obstacles?
Well, I did. I heard doctors also be quite frustrated that they couldn't get insurance to cover it. They'd have a patient that would benefit from it, and the insurance would reject it, and you're sitting there with someone who's going into acute withdrawal, and you don't want them to walk out of the office and start using again. And also, of course, they have to take an 8-hour training course to be able to prescribe it. But at the same time, I heard stories, I'd go to some community meetings and someone would stand up who worked for a doctor who prescribed Suboxone, and she would talk about how she always prided herself on never turning away someone, always returning calls, and she'd have so many calls. There'd be so many people wanting treatment, and they could not find a doctor who could provide it. And they were desperate, and it broke her heart that she'd have to tell them, we can't help you. So there are not very many addiction doctors in this country, and there are even fewer that can prescribe. And I think there's been a push to start training nurses and letting them be able to prescribe Suboxone, because it isn't particularly heavy lifting, because people start doing really well. And, the best Suboxone programs, though, also offer therapy and support groups and a lot of other services, because once people start being stabilized and not experiencing cravings, they can really begin to heal and try to understand all the reasons that were driving them to use drugs.
Thank you so much
for
that question. Yeah, thank you. And everyone, thank you so much for joining us on this call. This has been just terrific, Diana and Sarah. We're going to send out a digest of the call with links to clips, and please follow up by email if you want information or linkages to either of our speakers today. But other than that, this has been great. Have a wonderful evening, everyone. Thank you.
Thank you.
Thank you.
And that does conclude today's teleconference. We thank you for your participation. You may disconnect your lines at this time and have a great day.